Hi everyone, thank you for joining me on my channel. Today I want to talk about being an inpatient in a mental health ward. There are two ways really that you can become a patient of a mental health ward of a hospital. The first is voluntary, where you go to the hospital, you see the crisis team, then you meet with a psychiatrist and you collaboratively decide that you are unsafe and need to be in a hospital to maintain your safety and well-being. The second is when you're brought into the hospital, often by family or police, and you see the psychiatrist who decides that you need to stay in the hospital for the safety of yourself and or others. They then place you on a Form 1 and they give you a copy of a Form 42 that lets you know what's going on. If they don't give you that Form 42, the Form 1 is not valid, and your retention at the hospital is therefore unlawful, so they can't keep you. This is a Canadian, or at least an Ontario law, so they may differ in other countries. So there are many staff who are involved in the care when you're in an inpatient receiving mental health care. These include different things, or different people, depending on where you live, your needs, but are often similar. They always include a psychiatrist and nurses, but they can also include mental health workers, peer support workers. They often include social workers, can include general practitioners, like a doctor for physical ailments, or other specialists depending on your need. So seeing your psychiatrist can range from every day to once a week, and if you're in a place like Ontario Shores, which is a mental health hospital in itself, it can sometimes be even longer. Depends on how busy they are, what ward you're on, and how long they expect that you're going to be there for. They're not going to come as frequently if they put you on a Form 3 and they know you're going to be there 2 weeks anyways. They're more likely to see every couple days or every 3 days because they know that you're not going anywhere and they don't have any plans to let you go anytime soon. So nurses are there for you for everyday care. They give out medications that the psychiatrist has ordered. They're supposed to be there if you need to talk. And I say supposed to because they not only do they have other patients on their caseload, but some of the nurses have better work ethics than others. And I'm going to put out some other videos on my experiences with the nursing staff and security soon. So keep your eyes open for those. Psychiatrists often are they are the ones who look after your medications and whether you need to be started or your meds need to be adjusted. As a trauma survivor, there's not actually many medications that'll treat what's wrong. At most, you can treat the symptoms. Appropriate therapies are the way to go, and PRNs, which are kind of as needed medications that you can take to calm things down in the moment. However, you don't want to take them too much as your body will develop a tolerance and they won't be as effective. I take lorazepam, but I only take it when absolutely needed. So I've taken it like twice in the last year, maybe 3 times, but I don't take it very often, but I'm doing pretty good. So I used to take it a little more, but so I find the negatives about being in hospital is that there's no or extremely little treatment. Often the groups that they say they're going to have get canceled. There's minimal support as the nurses are often too busy. They have lots of clients on their care, or patients, I guess. Or they don't have the work ethic to actually leave the nurse's station and want to talk to their patients. However, the positives are that if you need a safe place when you're feeling unsafe, it's a relatively safe place to be. And I say relatively because of some of my own experiences that I'll talk about in future episodes. Also, there are always other people around to talk to that are supposed to be knowledgeable in mental health. Finally, the better hospitals do have programming and treatment from empathetic staff. Also, it's kind of nice to be around other people because some of them you can talk to who are going through similar things. So it's nice to have that camaraderie, I think is the word, of knowing, you're not going through it alone, because I think that's really important. So I hope this helps you understand the inpatient hospital process for a mental health stay. It's not as scary as I thought that it would be my first time. If you have any questions about any of the process or how being a patient in a mental health facility is, leave them in the comments below. If you like this video, make sure you click on the subscribe button and hit the bell so that you can be notified when any new content is created. Thank you so much. Be kind to yourself and respect yourself. Take care.